Good evening, everyone. This is the Health, Hospitals, and Social Services Committee. I'm calling it to order at 7:06 p.m. Uh, we have a few topics on the agenda today. I think we have a um, couple of special guest speakers. We have, I think, Kimberly Yue. Did I say that correctly? And she is an outreach and health insurance specialist for Medicare and Medicaid services um, who will be speaking. And then we also have, I think, Dr. Della Saffo, who will be presenting on the Green Book for Health. I do not believe I see her on as of yet. But nonetheless, we do not have enough for quorum, but we will, at this point, bypass the approval of meeting minutes for now. Um, so chair's report, not much to report as of the last meeting. We we discussed had a very spirited discussion regarding the health in general in the New York Health Act, much of which has been listed in the minutes and which we will get to at some point. In addition, I think our priorities for our budget priorities were submitted for the following year, but I do believe that our Vice Chair, Stephen Matthews, has some stuff that we will, I think, bring up under we'll bring up under unfinished business as well a little bit later. Unfortunately, the Ms. Castillo from Emblem Health was not able to present today, so we look forward to seeing that presentation at some time in the future when they are able to reschedule. Um, so that being said, um, we also have a guest member. You were able to sign it? Correct?
Oh, no, I didn't.
Oh, let's sign it. Um, and right there under
Yeah.
general public. Yeah.
If- For the affiliation, should I just say citizen or
Sure.
resident? I mean, I'm in a group, but I'm not here on behalf of them.
All right. So with that, um, Ms. Yue, do you have a presentation?
Yes, I have a presentation. I can share my screen if that's easiest.
Okay. And so if you could just tell us a little bit about who you are and the organization you represent, and I will transiently make you co-host right now.
Okay.
Did you hit the record?
Yes, yeah,
Recording.
okay.
All right, everyone. My name is Kimberly, and I am a pharmacist by trade, and I'm a health outreach specialist for the Centers for Medicare and Medicaid Services. And what we're doing right now is we're really trying to go into the communities of New York and New Jersey and really just inform everyone about Medicare fraud that's been happening within the US and could possibly be happening to you or someone you may know. So I'll go ahead and get started with that. I believe I should be able to share my screen. Does it allow me to? If I'm not the host, does it allow me to share my screen or no?
I think you currently have co-host permission, so I think you should be able to.
Okay. Let me see.
No, it's not.
No,
So I can just read off my slides from where I'm at if that's okay with you all.
go to more.
Sorry?
Does that help?
Let me see. One more, please.
We went through this the other night.
Let's see.
Oh, okay.
Yeah.
Anything, we'll see it? Okay. We have a
It started,
winner. All
Okay,
right.
perfect.
Yay. Thank you. So my presentation here is, of course, Medicare fraud, waste, and abuse prevention. And so our disclaimer here. So just some background, there are two main ways to get Medicare coverage. There's the original Medicare, which is where someone gets their health care through Medicare Part A, think of hospital insurance, and Part B, that's the medical insurance. And people can join a separate drug plan to get Medicare drug coverage, that's also Part D. And when someone does join Medicare, traditional original Medicare, they can visit any doctor that takes Medicare insurance anywhere in the US. Now, though there's original Medicare, there's also Medicare Advantage. These plans bundle together your Part A, B, and usually Part D. So they may offer extra benefits that our original Medicare doesn't cover, like certain vision, hearing, and dental services. So with Medicare Advantage, though, they may need to check to use doctors within their plan's network to get approval for certain drugs or services. So right now we're really pushing for everyone to be aware of marketing fraud that can come from different plans. And if one is to see it or experience it, we're really like pushing for everyone to contact 1-800-Medicare to report it. Or they can also check out cms.gov/fraud to look into other sources and how people were able to fight against potential fraud. So here we have our Medicare.gov website, and this is one of our landing pages where people can get information on how to report Medicare fraud and abuse. And we also have been pushing for everyone to go digital, and we now have our Medicare.gov/account. And we really encourage people to set this up because once you have it, no one else can have that account. It's similar to opening up your own Social Security account. Within the Medicare.gov account, you can go in and access important information regarding your health. So here, when you do open up an account, you're able to print an official copy of your Medicare card. You can access and share electronic health information with yourself, your provider, or anyone that's part of the care team. And you're able to view original Medicare claims. So here is what we call our Medicare summary notice. So when someone's in original Medicare, they'll receive these after every visit within Medicare. This is not a bill, but it is just information about seeing about what, if they did indeed go and receive services, they would see the claims that they were able to receive. And then you also have the option to opt for an electronic Medicare summary notice. Unless you will like the paper one. So unless you opt for electronic Medicare summary notice, for the most part, it will just be a paper electronic, it'll be a paper MSN sent in the mail. Now here, for people who have the Advantage plans, they'll receive an explanation of benefits. And this gives them really clear and timely information about their medical and/or drug claims. So here, we're really pushing for people to protect their personal information. On the left here, you'll see a Medicare health insurance card. It's the red, white, and blue card. This card, you don't want to share this information with anyone that's not your provider or if you're not in a hospital. These numbers are specific to the individual, and outside of the doctor or the insurers who pay for benefits on a beneficiary's behalf, this number should be protected. So there are some unfortunate consequences of sharing the healthcare card or number. There have been instances of people getting like their medical records are being wrong. They could be charged with healthcare fraud, that being if they lent their card to someone else to receive benefits and it was discovered that would result in being charged. And in extreme cases, someone may lose their benefits. But there's also instances in which someone's completely innocent and there's identity theft. And that is when someone else uses your personal information, like your social security card number. If you or someone thinks that someone is using information, we really encourage people to visit identitytheft.gov. And they can also visit ftc.gov/ID theft for more information about identity theft or to file a complaint online. So for medical identity theft, this is a really important issue because when this happens, it can lead to false or misdiagnoses, treatment for conditions that someone doesn't have, incorrect lab results, or bills for services that you didn't even receive. So it's really imperative that like if you ever see any like any claims on your MSN showing services that you did not receive, to please contact us so we can now start looking into the possibility of fraud. So here we have our 4 R's for fighting Medicare fraud. They're record, the first R, record for appointments and services, review services provided, report suspected fraud, and remember to protect personal information, so guard your card. You can also contact Medicare. So you can call to make a complaint, report fraud. You can have this information ready. When you contact us, please have like the provider's name, any identifying number you have, information about the item or service, including date and payment amount, as well as a date on your MSN. You can do this by calling us at 1-800-Medicare. We also work with another organization called the Senior Medicare Patrol, and they do an amazing job of educating people with Medicare on preventing, identifying, and reporting healthcare fraud. And I also have their numbers here from the New York number as well as New Jersey if you have any family members there. And for reporting suspected Medicare fraud, you can report suspected Medicaid fraud to the Medicaid Fraud Control Unit, the Office of Inspector General, and State Medical Assistance Office, which is also under Medicaid. So here's some useful phone contact information here regarding whether you're contacting CMS or Social Security or the Senior Medicare Patrol, in addition to the National Healthcare Anti-Fraud Association. Here's some more information as well. And here is another org that I want to share with you all, which is the State Health Insurance Assistant Programs. And this is a national program that offers free personalized health insurance counseling to people with Medicare and their families and caregivers to help them make informed decisions. What I really like about this org is that they'll really sit down with each beneficiary and help them in choosing the best plan based on their needs. I feel like no one leaves feeling like they didn't get all their questions asked. There's no question that's dumb. You can just feel comfortable knowing that you're going to get the help you need. So this is the conclusion of my presentation. You can let me know if you have any questions. And I also have my contact information here. So I'll stop sharing my screen. Are there any questions?
Can you send us a copy of the presentation?
Yes,
we
that
can
can
make
get.
it so-
Yes, that can get to you all.
Do you have the community board email address to?
Yes.
Just send it, and the executive, the district manager will get it and see that the information can get posted and circulated.
Okay, sounds good. Thank you. Now I should stop sharing. Thank you very much.
Thank you a lot, Ms. Yue. I think obviously with the graying of America, and I think the outsized role that Medicare and Medicaid have had in the increasingly role in the past centuries, I think this is vitally important that people are aware of not only what their benefits are, but what the risks are in terms of fraud and abuse. In terms of resources, what kind of resources do you have to those who are not as technologically savvy? Because I think these are all things that are meant for people who are pretty adept with technology. And what resources do we have to reach out to people to make sure that they know about these things?
So right now, we have our paper tangible information where they can read as well. So I can have that mailed out to your office. Like I know some other community boards, they've asked me to send over a bunch of lovely Medicare information and they have it available. If you guys have health fairs or senior resource centers or anything like that, we're happy to show up to provide this information as well. We've even started going to church meetings just to let people know about what we have as well as hand out the resources. And then if someone has any disability as to not being able to like read or anything like that, we do when they contact us at 1-800-Medicare, we are able to provide them with resources. And I know one of the beneficiaries I spoke to, he has to read everything in enlarged print, and they were able to help with that as well.
Thank you so much. That's really, really helpful. And I think I'll
welcome.
make sure that we definitely will forward this to the agent committee.
That's right.
And make sure that they get a copy of access to this link as well. So thank you so much.
Excellent presentation.
Thank you.
All right, next up, we have Dr. Stella Sappho. Thank you for joining us, and she's going to be presenting on the Green Book for Health. So, hello, Dr. Sappho. You could just introduce yourself, tell us a little bit about yourself.
Oh, sure. So I'm Stella Sackle. I'm based in Brooklyn. I'm an HIV primary care provider, and I do work in healthcare improvement and advocacy and education. And I am working with community members on a project called the Green Book for Health, and I'll be talking about that today. I unfortunately can't project the screen. I just have PowerPoint along, which we can share with the group after our call, or I'm happy to I don't know if anyone has it and can share it. I sent it by email.
I believe we have it, and I think we can
Awesome.
project it. I think we have the PDF. We can project it, and then I guess you can just narrate. Is that okay? Oh, you're muted.
Oh, sorry, I said that's perfect. Thank you so much for having those up. And I apologize for the
All right.
noise of my child in the background. It is bedtime. So the Green Book for Health is a project. Oh, go ahead.
One second. Let me get this on the alrighty. Okay. Can you see it?
I can see it.
Okay.
All right, so this, you can go to the next slide. The Green Book for Health is a project that was created for and by members of the Black community in response to feeling like their healthcare journey was often very up and down, that individuals could face discrimination, could face poor healthcare delivery, and didn't always know what were the best places to go. Next slide. And in meeting with community members, one of the things that folks have asked for is something similar to the original Green Book. And this was created by Victor Hugo Green, who was actually a New York City postal worker in the 1930s. And he created it because after the Great Migration, Black folks would travel back south and to the Midwest, and they would want to be able to know which sites were safe and which places were sundown towns or were not safe. And so the Green Book really provided those insights. And it's sad to me that in 2026, people are asking for something similar for healthcare, but that is the place that we have been at, I would say, for a period of time. And so we've decided to create this. And this Green Book has two parts. You can go to the next slide. There is a resource guide that, you can go to the next slide after this. There is a resource guide that actually presents information about how you prepare before, during, and after a visit, and what you do if you face discrimination. And then it lists different resources to be able to help with different disease areas. And then the community guide is what's built for and by us. It's an actual app, and it allows individuals to be able to enter in information about healthcare providers that they have liked or health systems that they have liked. And other individuals can then see that, other Black healthcare users can then see that and be able to frequent or utilize those places. We're working on things like being able to show not just the location and the phone number and all those things, but like, insurance status, is that something that's also accepted? And that'll probably be a version 2 of all of this work. Next slide. The reason why I'm coming to the Bronx Community Board is specifically because we are at the point now where we've created the resource guide and the app is now available in the Apple App Store. We're getting it over to Google Play as well. And so we want to be able to get this out to communities because this is only as effective as people know about it and are able to fill it, give information about where it's good to go and are able to utilize it. And so I've been meeting with different community boards pretty much every day of the last couple of weeks and just talking about this and getting the word out and saying, hey, can we share in your newsletter? Can we share more information about this at any events that you may have? if you're doing an event, can you print some flyers? I can share any flyer that we have with a QR code where folks can learn about this. And also, can we encourage folks to just download the app and be able to utilize this? This is a national program, but we're really excited because New York, just like the original Green Book, New York is really a nexus for starting it. So we want to really see it grow here, and that's kind of what I'm doing by talking more about it and bringing it out into our communities. And with that, I'm complete, and I would love any questions or reflections that folks may have about this work. You can take the slides on. Thank you.
Any questions?
This is an app or a website?
Yeah, so it's actually both. It's an app so that individuals can have it on their phone whenever they need to access it, but it's also a website because some folks, may just want to be able, not everyone wants to download an app. So it's both for now, but we think the app is the thing that's going to be very accessible to people to be able to enter information about where they recommend or not recommend that Black healthcare users go for healthcare services.
And it's available on Apple, the Apple
Yes,
App Store, and presumably
it's
the
not yet on
other
Google.
apps.
Yeah, it's not yet on Google. We're getting approval to go to Google, but we are live on Apple. We consider all of this phase that we're in to be our beta testing. And so, as folks are using it and entering information, it's helpful, if you say, oh, this stuff is too hard to engage with or whatever, because we're working with our developers to be able to continually iterate upon this and improve upon it.
How many, how many sites are roughly currently in this iteration right now?
Yeah, so we are working with community-based organizations and community boards and local elected officials to get this out. And our kind of key sites right now that we're looking at is the Houston area in Texas and the Atlanta, Georgia area. We're thinking about how we'll be able to also get to Detroit, and then I want to build out a site in the West Coast as well. The idea is that we do some of these local sites and kind of prove our model with getting out into the community. And when I say that, I mean things like, a lot of Black folks are like, wait, you want me to do what on an app? Like, I don't really, so we're thinking about like maybe we need ambassadors and trusted messengers who can go out into these communities and share this information. So that kind of investment work at the local level is happening in those particular regions.
Here it is.
Yep.
Oh, very
And,
cool. You are tech savvy. You've done it.
in terms of like resources and funding, if I'm at like how is what kind of support do you have?
Yeah, I love
I
that.
think one of the concerns I have is that people might see this and get interested, and then it goes away in 6 months.
Yeah. I'm a very stubborn and persistent person. So that's part of the reason why I was reluctant to take this on, because community members are asking for it for almost a year before I was like, fine, let's do this. Once I started, I won't let it go. And so we've gotten initial seed funding from Robert Wood Johnson. We're working to get additional funding from another funder that may come through before the end of this year. And then honestly, you asked a brilliant question because this is not the environment where people are, rushing to pay for things that are for marginalized groups, right? And so it's actually been very hard to get funding. And it's made me think a lot about what is the business model that'll make this sustainable. I don't want to ask Black healthcare users to pay for a resource that should just make their healthcare more equal. And so I've been thinking about how do we ask payers and hospitals and other health delivery services to invest in something like this. And that's work that's being done. And so if anyone, there's really two asks here. If anyone can think about resourcing spaces that we can go to, especially if we do any local partnering with groups, I'd love to know. And also, would love if anyone has any kind of brilliant ideas about how we make a sustained resourcing plan, because this is really coming up as a community collected idea. And exactly to your point, I don't want us to put all the energy in and then because of funding, we can't continue it. So it will continue.
Excellent. All right, wonderful. Any other questions? I think it's a fantastic idea, and when I first heard about it, and it's like you said, in light of, I think it's got a great namesake, for
Yeah.
certain, and seems like a wonderful resource for the community. And, I think if you have any other copy, I'll see what we have here, but if you have any other copies of that spec sheet and or even the QR code so that at least the community
Yeah.
is available, aware of it.
I'll email to the emails that I have. I'll email something for the newsletter if you guys have one of those, or even like an email out to the group. I will add on the flyer. And I think there's one more thing that I send as well. And then if I can get a physical address for y'all, when we do our first printing, probably in early August, I'll send over some resource guides. And again, like this is targeted for the Black community, but anyone can use it. These resources are so helpful for anyone and everyone. And so you can have the resource guide out there for people to be able to pick up and browse through and see how they can help their healthcare journeys along. So I'd be happy to do that, to send that over once we get them printed.
And in the future, so beyond branching out, do you envision partnerships with other groups? Let's say like a Green Book for Women, or
Yeah.
or the LGBTQ community, et cetera.
It's funny, yeah, because every time we do this, people are like, "We need one for this community. We need a brown book. We need a this. We need a that." And I'm like, you know what? Let us build this one first, and then let's see what comes of it. My hope is that we end up not needing these, affinity type group resources, and that we just improve healthcare so that all of us can benefit. You know, um, but until then, we're gonna take care of people in the best ways that we can.
And I think on a related note, seeing that you do, since your public health is part of your forte, do you foresee using this resource and maybe creating sort of a white paper on best practices or models that can be then distributed to other organizations to say
Yeah,
like,
I'm gonna need
this
you
is
to be on our board because you're just asking all the questions. It's exactly it. Yes. So two things that we're gonna do. I don't believe that we should do any kind of intervention work that only help individuals to be better. Like because the Green Book was, helping healthcare users to be more empowered and emboldened to get the best healthcare experience. We can't ask them to do that without also improving the systems. So one of the things that we'll be doing as we find sites that people really like is we'd like to be able to fund an evaluation campaign that lets us see what do those sites do well that we can learn from, and then almost create like a Green Book certificate, right? For sites who want to kind of be evaluated and do just as well for the Black community. And we can create a training program. And the other kind of public health aspect of it is in local areas for sites where there's a lot of critiques about certain places, it'd be really helpful for us to then be able to um, take those critiques and go back to local health officials or public health officials and say, hey, your Black healthcare users are having a very bad experience in this site. These are the data to back that up. What can we do to make that better? So there's definitely a systems approach to this as well, but none of that can happen until we get to scale and we get to the numbers that we know that we can get to. But that's where everyone here really comes in because our ability to reach people is really the thing that we have to focus on the most.
all right. Thank you so much.
Thank you all so much. I really appreciate it. Thanks.
Looking forward to hearing what the next generation has to say.
Well, she's already back here. Look at her. She's back here. Oh, you couldn't see her. I have my background on, but she's in the tub causing trouble. So thank you all. I really appreciate it.
All right. Thanks again.
All right. Take care. Bye-bye.
All right. So, moving on, I think, do we have the matter of unfinished business, which was regarding, the resolution for New York, the New York State Health Act and or variants thereof. Um, so I do believe there are members of the community who do have a few things they wanted to say, but before, I would start with the fact that we do not have quorum, and so there's only about half of our committee here. So I think we won't be able to move forward on anything today at this point in time. And so, but that being said, knowledge is power. And so if there are anyone who have any comments in that regard, I will open the floor and give a few moments. So
Should I just go first?
Go ahead, introduce yourself and
I'm
go ahead.
I'm Judy Fletcher. I'm a retired teacher from the area. I live in Riverdale.
And you were here last month.
I was here
Oh,
virtually
right.
last, yeah. I have a lot I could say. I'm gonna try to keep it brief. But I did put together packets of flyers and information sheets I'd like to leave with you if that's okay. Or I can email to you if you don't want all the paper. I'm an activist working on the New York Health Act. As I go around speaking to people, I find that many people don't even know about the bill. And that there are many, many misconceptions floating around. So there's many I would love to address, but I'm gonna just bring up a few that'll fit into a short time. The current system tying health insurance to employment creates a society in which people have to stay in jobs they hate just in order to stay healthy, and have increased stress as they fear losing their jobs, especially in light of massive layoffs when the economy or a particular industry is doing badly. Worse, it ties us to the for-profit system over which neither the employer nor the client has any control. Prices are going to continue to go up and coverage will continue to erode. So that's one thing I wanted to address. A few of these address things that were said at the last meeting. 95% of New Yorkers may have coverage, but that doesn't mean that they can afford care or even the growing cost of insurance. The facts on the ground show that people are delaying and deferring medical treatments, cutting their medication doses, and going severely into debt, becoming ill, and even dying because of our current system of profit-driven healthcare. And in response to the one big, I can't say beautiful bill, HR 1,
That bill.
that bill. The people have come up with different words for the acronym. In response to that bill, millions more patients are and will be losing their insurance and access to healthcare. So the 95%, number one, doesn't say how many people can access care, and it also we're expecting a lot more people to lose coverage in the coming months. Third point, as insurance companies abandon unprofitable programs, especially in so-called Medicare Advantage, patients are losing healthcare access and access to the doctors whom they want or have been seeing for years. We also have to deal with false information on websites about which doctors are actually in network. You try to go find out if your doctor is in network and it's not up to date. I have other things. I can just simply give you a copy of what I've said, or I can go on and do a few more of them. Should I do a few?
If you take one more.
Okay. Waiting periods were mentioned about for single payer for Medicare for all. And I just wanted to point out that I already have to make my doctor's appointments a year or so in advance, so I already have long waiting periods. In recent years, I've almost always had at least 3-month waits to get in to see any kind of specialist. And I've had a visit with a particularly popular OB doc postponed repeatedly by the office, stretching on for 3 years of delays before I decided to seek a different doctor. So I think it's already a problem in our health system. Shall I go on or? I don't want to.
Sure, you can do it.
The issue of people working in health insurance losing their jobs came up. There is specific and extensive language in the bill that directly and thoroughly covers that issue. What I remember from it is it provides 2 years of pay, unemployment pay while they train, and it'll provide them with free training and help them find jobs in the new system where many of these workers will also be able to be employed. So I haven't said everything in that section, but that's there. Another point of concern I had, I sympathize with it, but I do want to discuss it. I love my health insurance, or I have great health insurance, is true for a number of people. And my reaction to that, while sympathetic, is that's well and good. But to have a healthy society, we must consider everybody's healthcare needs. This requires compassion and a moral, humane concern for others. Even considering only my own self-interest, if the people around me are getting sick and not being treated, they can make me and my family sick and flood the ERs and hospitals when health treatment is postponed until it becomes an emergency. In addition, we all will suffer when the new federal policies cause hospital closures, especially rural and safety net hospitals, and this is already happening. I just have a few more, so it's like 2 more minutes. Should I do it?
You can.
Thank you. Prior authorizations in the current system keep people from getting the care that they need and create confusing, time-consuming, and expensive processes on the part of both patients and the doctors who are trying to treat them. These are all things that I think need to be fixed. The New York Health, surprise charges are rampant even now. Many people don't have Obamacare, and it's also being gutted. The New York Health Act would eliminate all of these problems. It would protect us also from the increasing privatization of Medicare and even VA operations. Unions, the authors of the bill, have made concessions in response to union concerns, some of which I found at a meeting with Andrea Stewart Cousins she didn't even seem to be aware of. So it can be found in the bill, and I do have an information sheet that gives some basics about it. I got go to the NewYorkHealthCampaign.org, NYHcampaign.org for more information, and PNHPNYmetro.org. So I would like to give this to you, and if you'd like, and I have a copy I printed out of the white paper as well, which is new stuff that I think surprised even advocates for the bill. It weighs huge savings that they can actually put into some kind of a formula and tell you what your county or well.
Thank you. Thank you so much.
Thank you.
Anyone else wish to speak on this topic? So I think with that, Vice Chair Matthews had some, I think, updates. I think you wanted to, cover the status of things.
Moving on from this, or
What was related to just the
well,
status.
given that we don't have a quorum tonight, and we're the absent people who have personal reasons for not being here would normally participate in the discussion. Given that the bill was not put on the floor of the legislature during the just completed session, and the legislature has now adjourned, we will take this up in the fall. When we reconvene. Before this committee can do anything, we have to have a quorum to pass a resolution that then goes to the full board. The last meeting of the year for the full board is in a couple of weeks, so there just is no procedure to discuss it further.
But I did, but obviously we appreciate your being present.
Yes, and your testimony will be included in the record.
Yes.
I wrote it down too, so I can give it to you, so everyone can see it. Timely would be great. There's a huge effort now, as you know how long we've been trying to do this, since before I was born. We're really gonna.
Since the next last one, the championship.
Maybe they're connected. We're hitting the ground running in January we really hope to get it passed and new strategies. And so if you could have it before, then any support we can get. So we're grateful.
Senator Rivera, who is the prime sponsor of the Senate bill and happens to be the senator who represents the community
Yes.
board area, gave an excellent presentation to us back in January, February,
Yes.
December, sometime. So we have been discussing this for
Good,
a period of time. There are a lot of questions.
yes.
And my personal advice to you and your colleagues is to, rather than focus on the savings, which the current white paper, which I circulated to the committee
So you
when
wanted-
it came out, we read it.
Okay.
An explanation in simple terms, the way Kimberly Yule explained how Medicare works to us, I think would be very helpful in making people understand how this bill is going to work.
About the financing or the
No,
bill
about
itself?
how the bill is actually going to work. Who is going to be in the network? I mean, they're here.
Yeah, I think what it is, yeah, these little,
The way
they're brand
they're
new.
built,
They're brand new, that's why.
I think, and I speak as someone who has worked in the healthcare field for a
Yes.
number of years. I think there are kind of two areas. How is it going to affect physicians and hospitals? And how is it going to affect individuals? And when I say individuals, that includes not only individuals who currently have employer-funded insurance, but people like myself who have Medicare and Medicare supplement, people who have Medicare Advantage, people who are on Medicaid,
Mhm.
and people who are on the essential plan, the Obamacare plan in New York, which regrettably has not been sufficiently funded this year. And if my recollection is correct, the estimate is about 400,000 people will lose coverage.
Yes, and we tried to get that covered in legislation and in the budget, and that was a big disappointment
Right.
to them. We've been trying to.
I think certainly is alluded to. I think one of the things that was brought up last in the last session, and I think in detail, is that there are obviously a lot of stakeholders who, by virtue of again the Byzantine nature of healthcare now, when things change, and I think there were questions of when things change, what happens? Because again, I think there are some people where it's very straightforward, very clear. There are going to be some people where, as many have said, whether they're in a union, retired, etc., where there's a slate of benefits that have been carved out, and then that potentially could go away. And so I think there's a lot of questions about I think the devil's in the details, as my colleague Ms. Spalter has stated on many occasions. And so I think that the chief concern for many is obviously going to be a matter of what's the fine print? How does this work in practice? Do we have a plan, et cetera?
Not only that, I would suggest that someone or a committee go through this bill. I thought I have a copy of it, which is.
You don't have a tattoo on your arm?
My recollection is it goes to 20-something or 30-something pages, and it is written quite efficiently in legislative language.
But I'm not that educated on this, and I've read it 3 times, and when I didn't understand it,
And I'll bet I could start asking you questions based on my reading of it, and.
I would have seen something else.
Yes,
Yeah.
so,
But I will say that Dick Gottfried is really good at, and he also on the PMHP website, there's if you read the facts and don't get your questions answered, you write to him and he answers. And I do have a page or a multi-pager from him. Yeah, but Medicare would be,
my experience in writing material for Medicaid and Medicare beneficiaries is we were supposed to keep it to roughly fourth or if necessary, sixth grade language.
Yes,
Um, that's a goal that I would,
I'm
Oh,
writing that, yeah,
so.
but I do.
And that would,
information
and that
sheets
would
to
help,
spell it.
that would help not only the members of this committee who, all of whom have some degree of experience in the
Yes.
healthcare field, but the 50 or how many ever members of the full board who will have to vote on
because it's a-
any resolution that we put forward.
Okay.
All we can do is recommend our support, that the community board, members of the community board urge the legislature to do something or support a specific piece of legislation. But we've had this before with other pieces of legislation which are complex, as legislation has to be if it's to be effective. So if the full board is to understand what we are supporting, and as we said, this will be a continuing subject.
It's not, yeah, this is not the end.
Okay.
But like I said, in light of where we are, again, any data is helpful because we can obviously, I think ultimately this is as Mr. Matthews stated, this is complex, and so what it's complex, so whatever we say has to be either equally as complex or equally efficient.
Well, we also want to make sure it's accurate.
And
It
accurate,
can't be
absolutely.
simplified to the point where it's not accurate, so it's a challenge.
So,
May I comment? May I say something?
of course.
Hi. Okay. I've attended for several months and I've made, several comments. I also don't really understand who determines the coverage, the new bureaucracy and what that entails. I didn't see the anti-fraud mechanisms, which I believe everything needs to have that, unfortunately, in. And I didn't see, because they said if we don't get waivers, we'll do something else. But what is that plan B? Because it would be historic that this amount of waivers would be being applied for and being given. It hasn't really happened. So, or like,
Dick Gottfried has explained it in very clear language. I've heard him do it a couple times. I'm not sure I can do it in as articulate a way as he did. It basically goes all into a pot. You would, if there's a waiver, then it's seamless on the user end, on the patient end. If we don't get the federal waivers, we still can do it financially. I think there's a slight decrease in how much the finances would be better, but not a big one. And it would just be kind of a two-part thing where you have to submit your Medicare card and your New York Health Act card, as I understand it, to the doctor. But then all of our money has been pooled. Our Medicare, when I get Medicare and so on, it gets pooled and is used as part of the New York Health Act fund. Now, he can explain it more clearly.
no, I'm sure. I mean, I only saw general when I read the bill. I'm sure there's more, and people have sent me stuff to read. It's a lot. It's a lot. But what I'm hoping that New York will look at the studies that other states have done and pick up and learn from them. California has moved away from single payer to universal coverage. Nevada, Vermont, they spent 4 years studying it. So it's New York would be the first, but there are a lot of lessons to learn from other states that have been also endeavoring to do this. And most notably, from what I read about what happened in those states, it's taxes, the raising of taxes, how much taxes and the costs. So it's complicated, and I think that a few more months to look at it and study it and and come back together would be very, very helpful. And I think I applaud the committee with the openness that you have taken and the months that you have spent and inviting the community. And I think that you've done a really excellent job.
Yeah, we've been very grateful for this opportunity. Laura, I do know that I don't know if you go by last names or first names, I tend to use first names, but they have revised the bill over the years, and much of it has been in response to research they've done in the other states. So again, I believe they've addressed most of those issues, and it isn't the same as the bill in California. I think more of it has been opposition based on special interests that are threatened than on problems with the concept of the bill, say in California.
But anyway, well, I think
But I will pass this all
Thank
on
you.
to the people.
but I think that said, I think that there's definitely an interest and a hunger for more information, and I think obviously the when Senator Rivera was here, it was well received, and so I think we will reach out to both his office and I think to also to Representative Dinowitz, who I think is also
He's supportive
he's
of it
supportive
as
as
well.
well. And so perhaps we can maybe have a more open forum.
Would it be
for-
helpful to have Dick Godfrey
I-
come, since he
let's-
wrote the bill? He's extremely
I
articulate.
think that if anybody's willing to come, I think we can certainly have a big open forum. Because I think that again, knowledge is power, and I think the more people that know about it, better.
Okay.
And the more opportunity that we all have to take, I think, all these very well-crafted points and make sure that they are addressed. Because again, the only way we're going to get anything good is if we make sure that we got to kind of we got to give it its you got to do the C testing as it were.
Yeah.
And so you got to let them they need to know what the concerns are from the community so that it can be either put in and or make sure that those things are articulated so that people are aware.
Would you like me to send you all the video of we had a town hall meeting forum with Gustavo, Dick, Betty Collard, and Peter Arno, who's a medical economist. And we had it with NYCD 1615 Indivisible, and I have a
Sure.
copy. Can I have the email so I can send
I
it to
think
you?
we can send it
You
to
can send it to the
community board.
send it to the board.
Yep.
Be it here.
Oh, can
right
I
there.
have this or a copy of
Yeah,
that?
yeah. No,
I can
it's
take
there.
it.
It's our letter. It's our letterhead.
Okay, sure.
And the district manager will see that it gets circulated appropriately.
Okay,
What we have
perfect.
discussed, as Dr. DeBeethan said, is we have talked about here having some kind of an open forum with representatives,
Right.
Senator Rivera and perhaps others, if Dick Godfrey were available. I think, I'm certain he would be welcome. And given the interest, not only members of this committee, but members of the board and I think it's safe to say members of the community based on the number of you and your friends and colleagues who attended the last meeting, either in person or online, and the number of city employees in the community would be interested. Fortunately for you, given that the bill, there was no action whatsoever on the bill during this session, at the point where it is actually going to move to committee discussions in either or both houses and potentially move to the floor of the legislature. would, the time would be appropriate. I think,
And if you wanted to have an open forum, would that be in the fall then?
it would be the fall or the winter
Okay.
at some point. I mean, you know, to some extent, that would depend upon
Their availability.
our schedule,
Yeah.
and the community board schedule, and the availability and interest of the presenters. I think it is until there seems to be a degree of action in the legislature, which we have not seen at all, other than the fact that X number of assembly members and X number of senators
Yeah.
have signed on as co-sponsors.
Yeah.
Until it seems that there is going to be some action on a piece of legislation, it's premature, quite frankly.
Okay.
We can talk about it all we want, but we're talking to ourselves. And, so,
Thank you.
and everything you say that is wrong with the system is arguably correct.
Yes.
I don't think you will find very many people who will disagree with that. There is something to be said for the general concept of Medicare for all, which is colloquial language for
Right.
what we're talking about.
And
here.
Medicare is flawed. We don't have dental or vision, so.
Well,
we want
I mean, off the record,
enhancement.
that's one of the questions that I would like to ask Dick Godfrey.
It's covered.
How are you
Oh.
going to cover dental and vision?
Vision and hearing
Be
and
on
long-term
here.
care. Well, long-term care is.
Number
the big
one, how are you going to afford to do it? And number two, where are you going to get the network?
You don't think we have it just in the people we have in the state? Oh, because some
It
of
used
the
to
more
be
people
said,
will be doing.
this is totally off the record, and since it's only the three of us who are talking here. Used to be said when I was growing up, that men and women who went to dental school because they weren't smart enough to go to medical school. Wayne, did you hear that when?
My roommate might say differently, but.
Right.
Although I.
Wait. The
The
flip side of that, which I have said to my dentist and some of my doctors and my clinical and non-clinical professional colleagues, is it just shows you how smart the dentists were because they refused to go along with Medicare.
Oh, wow.
Right?
Is that why they,
They didn't
Wow.
want, I was too young or not paying enough attention when it
Yeah.
happened, but the dental society did not want to have anything to do with Medicare and tried to find a really valid network for any commercial dental program.
There were, I think, some of this reflects just the history of healthcare, right? Why did surgery become part of medicine and dentistry not?
Right.
And obviously, I think they were able to take that to advantage. And to your point, I know of a dentist who, while we were in school, basically told the dental students, how much money you make depends on how many hours, how many days you want to work, right? So obviously, yes, there is a number of flaws in the existing system in general, and so when we do talk about systems when we are talking about a new system, how do we capture that, right? How do we ensure that I had to go through. I can't tell you how many hours of research I had to go through to find like which, who supported Davis Vision, so I wouldn't have to pay through the nose to get my new glasses, right? And I work in healthcare, so if we have this kind of this crazy serpiginous path that we have to follow, so then when we are now creating a new system, how do we ensure that the flaws of the existing system don't get stamped upon this new thing too?
Okay.
Um, but yeah, that being said, all
With health insurance, everything is network, which is the advantage of Medicare. And even with Medicare, a significant number of physicians not directly affiliated with hospitals have are no longer accepting Medicare.
Well, I have a friend in
And-
Columbia who won't take new Medicare
That's right.
patients, but I haven't had any trouble.
No, and
Finding
I
doctors.
haven't either, but it is becoming, I have several friends who are either specialists or primary care physicians who have gone concierge.
Mhm.
If you are not part of an IPA and
Yeah.
a network affiliated with a hospital. If you're in private practice, and I think that was one of the things that probably drove dentists not to want to participate in Medicare, because most dentists are in private practice. Responsible for all their own, so on and so forth.
With
Okay,
that said,
well,
thanks.
so I'm sorry, I have the white paper, but you've already done it, so we don't need
You
it.
can leave
You
it.
can-
I'll leave another
Sure.
copy, because I hate to waste the paper, usually I don't print.
There
it.
is I think, by the way, there is a webinar tomorrow evening. And I think there's another one on Monday evening.
People are holding.
Yeah, no,
Yeah.
your group,
Well, I'm
it's on-
working with a bunch of, it's the one,
But this is
Yeah.
the national group that, or the.
Oh,
the-
this
The
is
one
the
that, yeah, the
national.
one that's, what's her name, Melanie, I forget.
Melanie Darrigo.
Yeah.
Yeah, she's a new leader as of,
Yeah.
for the last year.
Yeah.
Yeah,
So I've been watching.
yeah. I'm the health committee co-chair for NYCD 1650.
All
But
right,
anyway, here's a packet of, that's my comments.
Okay.
And then information sheets, one is several pages from Dick Gottfried. And then specific issues are addressed. I thought they might be too simplistic to be presented, but it sounds like maybe.
To be continued.
Yeah, thank you.
Excellent, thank you.
All right.
So I think,
Yeah, just
No,
a
for-
couple of things on
yes.
old or existing business, to add to the record, two of the budgetary proposals that this committee made were to fund harm reduction
Mhm.
programs. And of interest to that position, on May 20th, the New York Times ran an op-ed complaining or commenting that moves by the current administration against what are known as harm reduction approaches are very likely.
Should I go?
You're welcome to stay or welcome to leave.
Okay, I think I can add anything. So, and I noticed that Laura Spalter has her hand up.
Oh,
Hey,
Laura,
Laura, sorry about that.
question, sorry.
Didn't see you.
Thank you.
Go ahead, Laura.
I thought I lowered it. I'm sorry.
Okay.
I'm done. Thank you.
This editorial, this op-ed states that the reduction in harm reduction programs are going to lead to an increase in overdose deaths. So I think our approach was well advised.
Right.
The second item that we proposed for the budget was an additional domestic violence officer in the 50 precinct.
Right.
And coincidentally, on June 1st, the New York Daily News had an article in which the district attorney's office, Bronx District Attorney's Office, is quoted extensively in saying that many domestic violence cases are not prosecuted because victims won't cooperate
Mhm.
with the DA's office, even in instances where the victims themselves
Right.
called 911. And I think that is also an indication. This is specific to the Bronx,
Right.
although it's a citywide problem. I think it's the problem that exposes would be greatly helped by our recommendation that the 50th precinct have another domestic violence
Right.
officer. I spoke to Ed Green, who is the chairman of the board's
Public safety.
safety committee, and he is aware of it. I gave him a copy of the article, but he said it's also been a topic of discussion at the board. So just to say that we are on top of issues that we
Okay,
Should be.
we're doing what we're doing what we gotta do.
and
Future business, I think was just be discussing some of the, I think, since we don't have quorum, I think we can kind of, if there are any ideas about anything specific for next year that we really want to see happen.
I mean, there are, I also, and I'll give them to Farah. I'm on the NYC DOH
Mhm.
mailing list of clinical advisories. And they happen to have put out two recently, one on antivirus,
Mhm.
and the other on the Ebola. And I think while they are geared toward a clinical audience, the information is easily approachable for non-clinicians, and it's something I think could
Yeah.
you post on our website
Right.
circulate. And then one additional item which falls into the social services aspect of this committee is a recent article that appeared on one of the news websites that I read too much of, about what to know about the new SNAP rules.
Right.
If you have lost benefits, and I thought I would ask Farah whether this can be circulated more widely. I went over it, and I think it's accurate to the best of my
Yeah.
knowledge and helpful at the very least as a start.
No, I think absolutely. No, I think that's a good idea. It's definitely a good idea. So I think, like I said, sometime we'll definitely focus on like either a roundtable or open forum with the New York Health Act or some
Yep.
variant thereof. I think it might not be a bad idea to have a representative from the domestic violence office at the and at the 50th. Maybe come and give a presentation.
Well, and that, this is not an area that I'm terribly familiar with, but it's easy to understand why a woman, and it's generally
Typically,
male on female, that a woman would call 911 when a spouse or a boyfriend or a relative is being physically abusive. And then once the situation is
stable or just
stabilized or calmed down, to think about, oh my God, if I do this, if I ask charges be pressed, if I go to court, I'm going to, if he's taken to court, I'm gonna have to go to court and testify, and what is that going to mean for me? And am I putting myself at greater risk from him or his colleagues, friends, relatives, or whatever, and what about my children,
Right.
or so on and so forth. So I guess the question that I would have is there a social work
Right, so,
aspect
right.
to this, right? To work with the individual and to try and make some arrangements or
Right.
something to, I don't know, like I said, I don't have, my
Right.
wife is a social worker, fortunately, she doesn't deal with this, but it's clearly a problem.
It is.
And the district attorneys
Right.
admit, we would like to prosecute some of these people, but we
Yeah.
can't because it's one thing he said, she said, but it's, if she doesn't say, there's nothing that can be done.
One of the things that I found interesting, because I've unfortunately had the opportunity to look up some of this in the past, is that particularly for police in general, and particularly for the NYPD, once a charge has been filed, if you go and say, you know what, I recant, I don't believe it, they actually will proceed anyway. Based on the assumption that somebody may have second thoughts or be intimidated. And so it was just fascinating to realize that once it's been triggered, they act irrespective. And then once it goes in motion, and then the cards, the chips fall where they may. Which is, I think, one interesting way of at least ensuring that it's not about intimidation or fear.
Right.
But that being said, you're right that the system can only go so far, right? And ultimately, like you said, if there's no witness, there's no witness willing to say anything. In particularly in cases that he said, she said, then where do you go from there? Which is, definitely a concern. But so this is, I guess, the last official meeting of the.
Absent some emergency
Absent
that we
emergency.
need to consider
Right.
over the summer, see you in the fall.
Info. I would like to thank you, thank you in the room for a great year. I think we definitely had some really interesting speakers and some very lively discussion. And I think I think the spirit of again, a committee that's there for health, hospital, and social services to actually be able to kind of talk about those things and get information out has been a wonderful thing. And looking forward to hopefully doing more in the future.
Yeah, and we pay attention to what is going on in the legislature.
Right.
And
Right.
the city council, and see where it goes.
Excellent. All right.
All right, yeah,
Well,
I'll see you in
see you in a couple
two
weeks, right?
weeks,
2 weeks.
and